Hi, my name is Dr. Chinmayee, and today we are going to talk about something which is referred to as the chronic dacryocystitis. Now, chronic dacryocystitis is a medical term, but what I am hereby referring to is a condition of constant tearing from eyes, which is medically referred to as epiphora. There is something called as a lacrimal apparatus, where you have the tear ducts and going into that sac and is being drained via the opening into the nose. For us to understand in a layman language, what happens is when there is a obstruction in its path of exit, precisely, the tearing happens more often, and those patients also come up with infection in over this site of their medial canthal area or near the inner part of their eye in common terms. So these patients primarily refer to an ophthalmologist, obviously, for this is a complaint of the eyes. But what you can see out here is that how an ENT surgeon comes into this play is that when there is an obstruction on site 1, 2, and 3, there are different ways of dealing with it. This is the upper puncta, this is the lower puncta, which goes through the canalicula into the common canalicula, and common canalicula opens into the sac area. So when there is this obstruction, whenever the obstruction is number 1 or number 2, very commonly, we are offering them more of a precise ophthalmologic guidance. When there is an obstruction on number 3, or where the sac is involved in inflammation, there is another route of entering it operatively and relieving this condition, which can be handled externally over here by the ophthalmologist and internally via this path by the ENT surgeon. That is through the nose, it becomes a scarless surgery, and when this inflamed sac is opened up and is kept open from inside, the tearing canal happens normally as it happens into the nose, and the patient's complaint of epiphora is relieved. This surgery is referred to as endoscopic dacryocysto and there are specific indications for this surgery. As I said, the site of your obstruction defines whether you are a good candidate for the surgery or not. The surgery is done by both our ophthalmologists as well as the ENT surgeons. Only the access areas of both the surgeons is different, and anatomical site that we are going to target is remains the same. One becomes a minor, very fine surgical scar, and the other one becomes a scarless option. For an ENT surgeon, if there is no other obstruction which is hindering from its view from internal side, that is from the inside of the nose, it becomes a very short duration procedure. But if you are having any pre-existing deviations and access in issues, there might have to be clubbed with certain other surgical steps for correction of those areas. I hope this clears your concepts regarding epiphora and in Gujarati what the patients come with nasurni taklif. Thank you.